And that's one of the reasons why I use yoga is because the breath work and the meditation helps with immediately calming them. So I don't have to delay my treatments for them to go and take medication or to go and see a professional that helps them with mental health issues. I can implement that immediately and get some immediate results with just teaching them how to breathe and the power of breathing.
On today's episode of the Modern Vital Podcast, we're going to talk about the impact that physical therapy can have on chronic illness and disease, specifically respiratory function and autoimmune disorders. And today's special guest is Dr. Nekita Sullivan, doctor of physical therapy and owner of Yoga Therapy Bar in Clemson, South Carolina, and a Medical University of South Carolina and Clemson University alumni. She's been using therapeutic yoga and Pilates for over 20 years to help others regain their physical strength and mobility, and now uses a direct VIP model to help those in need get the care that they deserve. She's a public speaker, and her personal story has also received national attention, being featured in USA Today and on Fox News. Her favorite mantra is, "Be kind to yourself." Welcome to the show, Dr. Nekita.
Hi, thank you so much for inviting me, Dr. Reebs.
It's great to have you. So I'd love to hear a little bit about your story and how you found, physical therapy and then now use it in the way that you do.
Sure. I was a four-sport athlete in high school. I was in love with volleyball, basketball, track, and flag football. My mother, actually, I have to give her all of the credit. She understood that I enjoyed sports and that I enjoyed health. And she was like, okay, what can we blend together to form something that she's going to love with both of these? And she saw that physical therapy was one of the top 10 professions for the next 20 years. And she brought it to my attention. I started volunteering and shadowing other therapists and just kept going and just kept going. And before I know it, I was finished with school and it has been a perfect fit for me.
Wow, that's
And I'm so
incredible.
glad I saw it through.
Yeah, well, I refer a lot to physical therapy, and we all know a lot of us know how important exercise is to just lowering inflammation and keeping
Yes,
detoxification going and helping with mental health. There
yes,
was a recent study I read in the British Medical Journal that looked at, physical therapy for people with chronic illness and anxiety and depression. And it found that it was 1.5 times more powerful than just traditional medications just to be exercising a few times a week. Do you
yes.
see that in your practice?
Absolutely. Now, I will be honest with you. When I was in physical therapy school, we did not get a lot of education about the mental health component. But my goodness, with most of the patients that I see who have some sort of pain component or an injury, there is often a lot of anxiety around pain because since their fear factor through the roof, so they're afraid to come, and actually, while they're doing their therapy, they're really anxious and fearful as well. So, one of the things that I've tried to figure out is what can I do to help my patients who have the anxiety component with the fear component? And that's one of the reasons why I use yoga is because the breath work and the meditation helps with immediately calming them, so I don't have to delay my treatments for them to go and take medication or to go and see a professional that helps them with mental health issues. I can implement that immediately and get some immediate results with just teaching them how to breathe and the power of breathing.
Wow, that's incredible. So do you customize each program or plan to each person, or do you sort of have a few things that everybody gets?
Yes. So I definitely individualize everybody's session because everybody's health situation, injury, illness, dysfunction is different. And I try to make sure that everybody understands that even if you're coming to me, let's say because of a knee replacement, your knee replacement is nothing like somebody else's. Your body's response to the knee replacement is nothing like anybody else's. So you cannot compare yourself. So yes, I individualize each session. But the thing that I have found with almost everyone that I see is there is always a range of motion and a flexibility limitation. So yoga, perfect solution to helping people with flexibility issues and range of motion issues. All right, number 2, I'm just going to be blatantly honest about this one. Most people's core strength is TRASH, trash. Okay? So there is Pilates. Oh my gosh. It will work the whatever you want to call it out of your core. So that's why I use both of them almost with everyone that I see, because those are two major limitations that almost everyone has.
That's amazing. And then I'd imagine you're getting the mitochondria firing, you're getting more oxygen to every cell. And then there's going to be all these indirect benefits no matter what they've got
Yes.
going on, right? Whether they've got respiratory issues or lupus or what are a couple conditions you're seeing a lot of right now?
Well, unfortunately, the American society is overwhelmed with arthritis, whether it's osteo or rheumatoid. Now, the thing that I really like about how I blend yoga and Pilates is it's low impact. Okay, so think about rheumatoid arthritis and how it attacks the joints. So, how do you continue to exercise when you know that your joints are suffering from damage? Low impact. So I'm not going to try to get these people to run or to jump. I'm really going to do things from an exercise standpoint that conserves and protects their joints, but also allows them to exercise. Because just because you do have some sort of illness or dysfunction does not mean that you can't exercise. And most of the issues that come as a result of not exercising, it's worth it. It's worth finding that perfect solution that allows you to continue to exercise, whether you have an autoimmune disease or are suffering from something that's affecting your respiratory function.
Wow, that's incredible. I'm seeing a lot of rheumatoid arthritis myself, and I mean, if people aren't moving, movement is
Yes,
medicine. They're not getting
yes,
better. Do you have a couple of examples of people with RA you've worked with, where just in working with you, you've seen it drop, 30, 40, 50% in the pain?
yes. So, for example, sometimes I have had the privilege to see people who are truly disabled as a result of their joints contracting. And when I'm working with them, it's so severe that you can hear it. You can hear the crepitus, you can hear their joints popping and grinding, and they will tell you that it's painful. But every time, I shouldn't be say every time, but mostly every time at the end, they will always say to me, it was painful while we did it. I didn't want to do it, but oh my gosh, I feel so much better. And I always have to remind them to think of their joints like car joints. Once you get that synovial fluid moving within those joints, it lubricates it. It makes it easier to move. It decreases the friction of moving. And you can't get that synovial fluid moving in those joints if they're stagnant.
There was another study I read recently, and it was about lupus, which we know there's a lot of arthritis in lupus, but it came out
Yes.
last year. I think it was in the British Journal as well, but it was in Lupus Science Journal. And it had 16 women with lupus who did exercise for 12 weeks. And it found that in all of them, it improved their fatigue significantly because we see so much massive fatigue as well,
Yes.
in lupus and in arthritis as well. I'm curious about
Yes.
that with the fatigue factor as well for you.
Fatigue is often a complaint that most people are having these days because they don't properly exercise. And then you've got all of these other contributing factors. But usually with sedentary activity, you're going to get a lot of the same issues. And with lupus, and most of the people that I see with lupus are women as well, and they're getting younger and younger. I have to remind them that exercise is a tool to help them manage their lupus. Is it going to completely take all of your pain away? No. But what if it will allow you to continue to be able to work? What if it will allow you to be able to maintain your endurance enough to where you can keep up with your kids? What if it will allow you to be able to function every day and not need to have a caregiver? Is it worth it? Then it's a resounding yes. If it's going to keep you from being disabled, then it's a resounding yes. I'm at least willing to try. And if I
Right.
can get them to try it, then I can get them to see the results for themselves.
Yeah, you and I had talked a couple months back on the phone, and I know you were kind of rolling out sort of telehealth services, or you do offer obviously telehealth services, which we all began really doing in the pandemic. Are you working with people with lupus and arthritis sort of over Zoom now too, quite a bit, or is it more that they come in office?
Yes, and it depends on their condition. So for people who are having a lot more pain, who needs more hands-on physical therapy, of course, I invite them in. But for those who are just needing a good therapeutic exercise session, who don't really need the hands-on therapy, it's really simple and easy for them to do it out of their own environment where they're comfortable from a telehealth visit. And quite often, when people don't feel well, they don't want to be out in front of a lot of people, right? So I give them that option because I want them to be comfortable. I want them to feel like they're doing something in an environment that is going to nurture them and make them feel comfortable. And eventually, they may want to try some sessions in person, but I give them the option to do either. These autoimmune diseases really work on their mental health as well, right?
Right,
And
right.
anxiety. And sometimes they just need that initial start to get started before they decide if they want to come out in person.
Yeah, and I know that the healing power of touch is really big in your practice. Are you basically doing
Yes.
manual therapy with each person as
Yes.
well, kind of as part of it? I'd imagine that's a
Yes.
huge piece too, as well, just the touch and kind of the oxytocin and the calming nature of touch as well as being
Yes.
therapeutic.
And I have always been a manual therapist from the very beginning because there are some things, some imbalances that I do better with diagnosing when I can touch and feel them. Is it absolutely necessary? No. Can you do physical therapy without touching people? Yes. But it is a competitive advantage for me. And I truly appreciate people allowing me to touch them.
Yeah, well, as an environmental medicine specialist, I'm always looking at how the environmental factors are kind of making us sick, and we know that a lot of times our genes can get turned on by, environmental factors which can trigger an autoimmune disease, but everyone also needs physical therapy, and without that, people aren't going to get better. So what you're doing is absolutely essential. I'm really glad you're doing it.
Thank you. And I try to remind people to always think about not just the physical aspect, but we as human beings have 5 different ways that we receive information and we process information. We learned when we were little kids what our senses are, okay? And if you can make your senses happy, not giving them what they want, but giving them what they need, it helps your body come back into balance. If you can keep your sense of touch from being overwhelmed, or I'm going to make up a word, underwhelmed, okay? The same thing for your sense of hearing, smell, everything works together. So for some of my sessions, I'll usually diffuse some tea tree oil for an antiviral component or some peppermint to aid respiration because we take in information through our smellers. So all of that is important. What you're hearing, what you're smelling, what you're touching, what you're tasting, what you're feeling, all of that allows your body to receive information and process it. So if any of that is out of balance, it's going to cause you to be out of balance. So you have to truly approach an injury or illness from a holistic point of view.
Well, thanks so much for joining us today, Dr. Nikita. Where can people find your website or get in touch with you?
Yes, thank you. On the web, it's called Yoga Therapy Bar. So www.yogatherapybar.com. And I absolutely stay in close contact with all of my patients by email. That's the quickest and easiest way to get me. So my email address is info at yogatherapybar.com. I'm also on LinkedIn. I'm also on Instagram. I'm also on Twitter. And I'm also on Facebook. So you are more than welcome to reach out to me either of those ways. And I'll be glad to figure out a way to help you because I also do consultations. And that's the
Awesome.
starting point.
Thanks so much. We'll make sure to link to your site in the show notes. That concludes today's episode of the Modern Vital Podcast. We'd love to hear from you and we value your feedback. If you have any questions or suggestions, please reach out to me at ben@modernvital.com. Also, please leave us a review if you enjoyed this episode, and we look forward to having you join us next week for another exciting episode of the Modern Vital Podcast. And that's a wrap for today's episode of the Modern Vital Podcast. Your support fuels our mission to empower you on your quest for optimal health. Remember, our Modern Vital store offers supplements to guide you on your path to wellness. And don't forget to subscribe, leave a review, and share our podcast. Until next time, stay proactive on your health and wellness journey.